Can you see, Pat, that started recording? Oh, now I see it. Okay. Well, welcome, everyone. Thank you so much for all of your interest and your willingness to help us here at the Health Department with our COVID-19 vaccination clinics for our communities. My name is Courtney Mullins. I'm the RN Immunization Program Lead Nurse here at the Health Department of Northwest Michigan. So we're going to go ahead and get started on our immunization orientation for nurses, and I know we have some physicians here with us as well. So the first thing I want to go over real quickly is just some overview of our storage and handling requirements and equipment here at the Health Department. As most of you may know, the Pfizer vaccine is an ultra cold temperature requirement. We do have one ultra cold freezer for our 4 counties. That's in our Gaylord location. So all of our Pfizer vaccine gets stored there, and then it gets transported out to the different clinics that we're doing. We also have the Moderna vaccine on hand, and that just can go in our regular vaccine freezers that we have in all of our clinic locations already. We also have our vaccine refrigerator units in all of our locations. And then our cool cubes there are a portable vaccine transport. So they're smaller coolers that can be equipped with a temperature monitoring device and taken to all of our off-site clinics. So those come with digital data logger is what the monitoring device is called. We keep those in all of our portable equipment, and then we also keep those on all of our stand-up vaccine fridges and freezers in our offices. So if you are at some of our off-site clinics where we're transporting vaccine, you'll see those cool cubes and you'll see those digital data loggers. We usually have one nurse kind of keep track of temperature monitoring for those, and that's hourly, but that's something we can introduce you to at the clinic if that is something you'll need to do. Temperature monitoring for COVID vaccine must be done at all times, regardless of the type of storage. We all know these strict temperature requirements on these. And these portable cubes will only be refrigerated. So once we take that vaccine out of that ultra cold freezer, if it's Pfizer, or the regular freezer, if it's Moderna, it just goes right into the refrigerated cube. So it can't go back into the freezer after that point. So that's just a little overview on our vaccine storage units that we have. This first slide here is just some key differences between the Pfizer and Moderna vaccine now that we'll be using both. We've only used Pfizer in our clinics so far, but for our some of these mass clinics coming up, we'll be starting to get into our Moderna supply. So there's a difference in storage temperature requirements for these. The Pfizer is the ultra cold storage. That's a -60 to -80 degrees Celsius. Comes shipped on dry ice and then goes right into our ultra cold freezer. The Moderna, however, it's still frozen, but it's not nearly as cold. It's a -25 to -15 degrees Celsius. So it can be stored with our varicella vaccine in our clinic freezers. They're both multi-dose vials, preservative-free. The Pfizer is a 5-dose vial that we can actually pull a 6th dose out of if there's enough. And then the Moderna is a 10-dose vial that if there is enough, you can pull an 11th dose out of. They can both be stored in the fridge once they come out of the freezer. The Pfizer can only be stored in the fridge for up to 5 days, or a total of 120 hours once it comes out of ultra cold. And then the Moderna can be stored in the fridge for up to 30 days. And these are both only if the vial has not been opened or pierced yet. The Pfizer vaccine gets reconstituted with the normal saline that comes in ancillary kits with it. Once it is reconstituted, it has to be used within 6 hours. The Moderna vaccine also has to be used within 6 hours after it's opened, but no reconstitution is necessary. The times that they can be out at room temperature are a little different. When you take them out of the freezer, before you open them and start drawing them up, they can be at room temperature for up to 2 hours. But then after you pierce them, they do need to be used within 6 hours. And then the total time for the Moderna vaccine at room temperature, like if you draw it up into some syringes and have it out in baskets ready to go, the total time it can be out at room temperature, the total time it can be out at room temperature before it's all drawn up is 12 hours. So that's a little bit longer than the Pfizer vaccine. We do want to make sure though, when it's out at room temperature, that it's away from sunlight. As I draw it up, I kind of cover it with one of our drop cloths like a sterile cloth, just to keep it away from any excessive amount of light. The dosage amount for each of these is a little different. The Pfizer vaccine is a 0.3 milliliter, which is something we don't see too often with our vaccine doses. The Moderna is a more common dosage amount. That's a 0.5 milliliter. They're both 2-dose series, a little bit different with how long between doses though. The Pfizer vaccine is a 21-day or 3-week between dose 1 and dose 2. And then Moderna is a little bit longer. It's a 28-day. So you'll hear most of the time we'll say 1 month between the 2 doses, but it's a 28-day or 4-week. And then the other main difference I like to note, just to keep in your mind, Pfizer vaccine is approved for 16 years and up. Moderna, however, is approved for 18 years and up. So something to keep in mind as you're going forward. So we'll talk about each vaccine separately. We'll start with the Pfizer vaccine here, and we'll go through the steps of thawing administration for both of them. So thawing of Pfizer vaccine, it's shipped, like I said, at an ultra cold temperature on dry ice. Therefore, it must follow strict storage requirements and be thawed appropriately in order to maintain its viability. If it's removed directly from the ultra cold storage or the thermal shipper, then it needs to be thawed for 30 minutes at room temperature or for up to 3 hours at a refrigerated temperature. Up to 3 hours, they're saying up to 3 hours because for an entire tray, which is 195 vials, they would want you to have that in the fridge for 3 hours. If you're thawing 5 to 10 vials at a time, then it won't take nearly as long. And that thawing time starts as soon as those vials are removed from that ultra cold freezer in Gaylord. So whoever's responsible for, our staff will be responsible for transporting that vaccine from Gaylord to the clinic site. So that thawing time starts as soon as it's taken out of that ultra cold freezer and placed into our portable cool cubes for transport. So 99% of the time when you guys are there at these clinics, the thawing process will already be complete by the time you get there. Once the vaccine is thawed and kept at room temperature, it has to be reconstituted within 2 hours. So that's that point where if it's not pierced, you can leave it out for 2 hours, but then if you're not going to be able to pierce it in that time, you need to put it back in the refrigerator. Once it's thawed, the Pfizer vaccine cannot be refrozen. It can be stored in the fridge for up to 5 days, total of 120 hours, and that's only if it has not yet been pierced or reconstituted. There will be blank labels available at all these clinics. We have stickers. The vials are very small, so it's hard to write dates and times on them. But when our staff pull the Pfizer vaccine from the ultra cold freezer, they will be marking the containers that it's in with the time and date that it was taken out of that temperature. And we are taking that out, we intend on using every last dose. We don't carry extras with us to these clinics. We do require all of our clients to call ahead, register, and schedule so that we know exactly the number of doses that we need to bring. So there shouldn't be much need for us to label vaccine and put it back in the fridge after clinics are over. The next step for Pfizer is the reconstitution after it's thawed. So Pfizer comes in 2 milliliter vials, and they're technically 5 doses per vial, but we were officially approved to draw that 6th dose out of each vial as long as it is a full dose. So again, Pfizer is 0.3 milliliters. So if you start pulling that 6th dose and it's only 0.2, then we can't use it. We can't pull leftover from 2 different vials and create 1 dose with it. So if it's not that full dose at the end, then we just get rid of it. Before we start reconstituting, we gently invert the vaccine vial and inspect the contents. The solution will be a white to off-white color. There may be some particulate matter in there, but if it's discolored at all, we would set that aside and not use it. We reconstitute it with 1.8 milliliters of saline diluent. This diluent comes in a 2 milliliter vial. Like I said, it comes in the ancillary kits with all of our other supplies. So you'll basically have 1 vial of saline per 1 vial of vaccine, but you won't pull the full 2 mils out of that vial. We do not shake. That's important for both vaccines, not to shake. They're both very fragile. That's why instead we say invert gently 10 times. So after that saline is in the vial, then we'll invert it again gently to mix it. And then we'll inspect it again. It will still be that off-white to clear. And then again, once it's reconstituted, it can be stored either in the fridge or at room temp. And we just want to note the time of reconstitution so that we can make sure once it's reconstituted, we use it within 6 hours. And laminated instruction sheets with these specifics will be available, one for each type of vaccine. They'll be available at every clinic for the nurses that will be reconstituting and drawing up vaccines. So nothing you have to commit to memory. Next step in the process would be administration. So it's important to cleanse the vial stopper before each withdrawal, before that initial saline diluent goes in as well. So being preservative free, it's very important that we remember to cleanse the vial stopper each time with a new alcohol prep pad. So even if we're drawing up all 6 doses, or for Moderna 10 or 11 doses in one sitting, we're still using a separate alcohol prep pad before each time a new needle goes in there. So the needles and syringes will be supplied as well. We were sent different lengths, so we have a 1-inch and a 1.5-inch needle. They'll all be there and ready to go for you. So with those needles, we'll drop 0.3 milliliters of the Pfizer vaccine for each dose. It's important to when you're trying to get the bubbles out, to do that while the needle is still in the vial, so we're not wasting any vaccine or entering the vial more than we need to. So really turning it upside down and trying to gently get those bubbles out while the needle is still in. It's a little more difficult, but it's definitely doable. We administer that as an intramuscular injection. That's the same for both vaccines. So right or left deltoid is going to be our sites of choice. There's a little image there. For those of you who haven't given an intramuscular injection, you know, maybe it's been a while. It's good to brush up on finding that deltoid muscle, finding the bony prominence of the acromion process, going about 3 finger widths down from that, and then finding the center of that, the meat of that muscle should be just above the level of the armpit. And then you'll want to insert that needle at a 90-degree angle. Go all the way in, insert the vaccine. There is no need to aspirate before injection. The link here on this slide is just to that little image I have there as part of it. Actually, it's a step-by-step for proper intramuscular injection. And then all clients will receive the second dose reminder card. That's also been sent to us with these ancillary kits. So the tech at the beginning of the clinic will start filling that out, and then the administering nurse will just write in the manufacturer. So whether it's Pfizer or Moderna, and then they'll write the lot number and their initials on the card, and they'll go over that more in our preclinic huddle we have before every clinic that we do. They'll cover all these responsibilities and roles for you guys. And this more details that I wrote down here, we have just-in-time trainings that we do. We've been doing them weekly so far, just to get everybody who's working the clinics that week a little more orientation to the clinic site, the flow, things like that. So I put one slide with some links and resources specific to Pfizer vaccine here. The fact sheet here, the EUA fact sheet, that's basically what replaces the VIS vaccine information sheet, which we're required to give to every client. So if you want to read through that a little bit, it contains all kinds of information from the ingredients to the contraindications and possible side effects. And then there's another link here to storage and handling. And it contains a video, which actually, if it has been a while since you've drawn up or administered vaccine, I do recommend that you go and watch that video. It's from the CDC. It's about 12 minutes long, and it's very step-by-step watching someone reconstitute, draw up, administer the vaccine. So it's a great little brush up. So that is Pfizer vaccine. Again, I'll wait until the end to get some questions going. So we'll talk about Moderna for a little bit now that we're just starting to get into for our use. Some key points on Moderna here that are different from Pfizer that we'll cover. Again, it's a multi-dose vial like Pfizer, but it is a 10 doses per vial, and we can pull that 11th dose. This is a 0.5 mil. So that 11th dose, you have to make sure you get the full 0.5 mil out. If it's only a portion, then we do need to discard it. Again, we can't combine leftovers from 2 different vials to create a full dose. So this, again, it goes in the freezer, but not the ultra cold. So thawing time for Moderna, 1 hour at room temperature or 2.5 hours in the fridge. And I cover this a little more in the next slide. If thawing in the fridge, we do need to let that vial stand at room temperature for 15 minutes before we start administering. And then just like Pfizer, we cannot refreeze this after thawing. And again, make sure not to shake it, very fragile. This one, the instructions on this Moderna site are to swirl it gently in your fingers, swirl the vial gently. So you'll do that after you thaw it and between each withdrawal. And then just a little note there, it is so fragile that they do recommend or require that if they've been shaken, if they spill over in transport, that we do set it aside and not use it and actually contact the manufacturer. Similar to what we do if we have a temperature excursion in one of our storage units, we would contact the manufacturer and explain the situation and then let them make the call of whether it's still viable or not. So that's just a key of how fragile this vaccine really is. So again, we do not dilute this one like the Pfizer one. This one just draws up straight from the vial. And just like Pfizer, we do cleanse the vial stopper. It is preservative free still, so cleansing that vial stopper before each entry. And then this dosage is 0.5 milliliters. And again, the other difference is that it's approved for individuals 18 years and older, where Pfizer was 16. So storage and handling in particular here, frozen, we already kind of covered. Unpunctured vials can be kept in the refrigerator after pulled from freezer for up to 30 days, which is great. Gives us a little more time to get through our clinics. After the first dose has been withdrawn, just like Pfizer, it needs to be, the whole vial needs to be used within 6 hours. Otherwise, it needs to be discarded. And we do have a couple of these mass clinics that run, I think, 6 or 7 hours. So for the most part, when we get these vials up, and even if you draw up a full vial at a time, we shouldn't have an issue with getting all those doses used up within that 6-hour time frame. And again, on the bottom there, never refreeze the thawed vaccine. Thawing for this one a little more specific, so we can thaw it in the refrigerator for 2.5 hours, and then if we do it that way, we need to let it sit for 15 minutes before administering, or we can thaw it right on the counter at room temperature for 1 hour. Again, you'll want to keep it away from sunlight, and then just kind of try to put it in a shady spot. It doesn't say much about keeping it away from room light, but I have been trying to do that. A couple links on the bottom there for more specific information about storage and handling for Moderna. Dose preparation here, a little easier than Pfizer, no reconstitution. Swirling the vial gently after thawing and between each withdrawal. Make sure not to shake. Same as Pfizer, it should be a white to off-white suspension. So we'll inspect that before we draw anything up. Again, it says it may contain the white or translucent product-related particulates. If it's discolored or yellowed, then we would set it aside and not use it. Another key there, it kind of shows the swirling motion. I think all of us kind of get that though. Not shaking, only swirling between our fingers. Another reminder not to shake. Each dose here is 0.5 mil again. And then just that bottom step is reiterating the amount of time it can sit out at room temperature or in the fridge after it's been pierced. So needs to be all used up within 6 hours. Administration, same with Pfizer. Only difference is the time between doses here, the 28 days apart. So here's a little bit better of an image for finding that the good meaty part of that deltoid muscle and making sure you're far enough away from that chromium process to not cause any injury, and still going in at a 90-degree angle. This slide here, it's not going to be, I don't think this is anything that any of our nurses or physician volunteers are going to have to deal with, but just so that you're aware, when you look at those Moderna vials, they come with a generic expiration date. I think it says like 2069. We have to go to this website and enter the lot number for each vial that we have in order to find the true expiration date. So if you are looking for an expiration date and you see that strange date on there, that's just something we'll have to get on the computer and look up the accurate expiration date for that vial. As for charting purposes for nurses, we don't actually chart the expiration date. We do chart the lot number. So this is more something that our techs will do as they're entering inventory, but just so that you're aware. The Pfizer vials, however, do come with an accurate expiration date. And then I've got one slide here for Moderna specific resources. Again, I labeled the EUA fact sheet for Moderna. So all that information, and those are what we give out to each client in place of the VIS sheet. Now we're getting into some slides that kind of cover both vaccines. So precautions and contraindications for, sorry, if anybody's not muted, if you could mute yourself. Thank you. So some precautions and contraindications for mRNA COVID-19 vaccines. The true contraindication that we're looking at is a known history of an allergic reaction to a previous dose of the vaccine or any component or ingredient of the vaccine. When this first came out, it was just a severe anaphylactic allergic reaction, but they have scaled that back a little bit. So now it is a contraindication if they have a history of any type of allergic reaction to a previous dose or a component of the vaccine, and that's for either one. I listed here some adverse reactions that have been kind of common in clinical trials, and they're pretty common to reactions that we see from a lot of vaccines, you know, pain, swelling, redness at the injection site, fatigue, headache, muscle aches, joint aches, chills, nausea, vomiting. Luckily, through my experience so far with clinics and talking to people who've had the vaccine, all our staff members, there have been very few adverse reactions noted so far, which is great. There is insufficient data for both vaccines regarding administering it to pregnant women or breastfeeding women. The data is just not available to assess the effects of the vaccine on the breastfed infant or on milk production or excretion. So pregnant or breastfeeding women may choose to get the vaccine after ideally discussing with their provider first, but they are able to get it. Those with a history of allergic reaction to any other vaccine or any injectable medication must be monitored after administration for 30 minutes. Those with a history of anaphylaxis due to any cause must also be monitored for 30 minutes. And then everyone not in those two groups must be monitored for 15 minutes. So the history of anaphylaxis, it's not just related to injectable meds or vaccines. You know, it could be a history of anaphylaxis due to bee stings or peanut butter, whatever the case is. We do need to watch them for 30 minutes after vaccination. And at all of our clinics, we will have EMS on site. So there will be an ambulance available in the parking lot. Most of our clinics, people will be fulfilling that wait time, that 15 or 30 minutes in their vehicles in the parking lot. And EMS will be kind of there watching over. And we always just ask them if, you know, if you start feeling unwell, difficulty breathing, anything is off, just kind of lay on your horn in your car, and then EMS staff will come and assist you. We also have our own staff, one member of our staff out in the parking lot kind of overseeing things and directing traffic. So if they see anything amiss, they will alert us as well. And then there are a couple sites, so I think just the Charlevoix Old Elementary School right now, where they might be doing the waiting inside the building because they have a larger room to space out chairs and have people fulfill that wait time inside the building. But for the most part right now, we're looking at that being in cars and parking lot. Charting the immunization is something that the administering nurses during the clinics will do. So we have separate nurses reconstituting and drawing up for Pfizer or just drawing up for Moderna, and then separate nurses who will do the administering, and we do the charting during the administering. So our EMR system is Patagonia. So I didn't have any familiarity with Patagonia before I started working at the health department, so it's okay if you guys have no exposure to that yet. It's a pretty easy system to get used to, especially when you're just going in there to chart this vaccine administration. So Kelly Motter is our Patagonia guru, and she will get initial passwords to get started in Patagonia. If you do not have a health department issued laptop, then we will have clinic laptops available for us to kind of get a generic log on, and then you can use your individual password into Patagonia inside that laptop. So we'll have those at all of our clinics, as well as people who can help you get started on them. I've created a cheat sheet for entering the COVID-19 vaccine into Patagonia, so it's real step-by-step. I put screenshots in there, so it's pretty easy to follow. So we'll have those available as well. Information after you enter the vaccination information, it'll go automatically into MICR, so there's no extra step that we have to do to get it transferred over. And those will all end up being in MICR probably by the end of the day. Some of them are pretty quick, some of them are within minutes. And then, like I said, each immunization will be charted by the administering nurse. So what I'd like to do right now real quick is pull up Patagonia and just show you what that looks like. It's okay if it's all kind of foreign to you, but just so that you have a little bit of exposure to it going in here. And I signed in beforehand. Is everybody able to see that different screen now? Pat?
Yes.
Okay, thank you. So this is our Patagonia main page or dashboard page. Once you log in, this is what it will look like. For the sake of this education, I'm just going to type in a test client. And I'll just show you what that immunization charting looks like. So there's different widgets here or apps that we use for our different programs in the health department. We just want to scroll down until we find the immunization widget. If you do have this little syringe on the bottom of the screen, I think those have to be put there by the user, but that syringe takes you to the same spot. So I'm just going to scroll down until we find it. So here we are right here. This is the immunization widget. So this is the only place in Patagonia that you're going to chart. You're just going to go right to this immunization widget after you type in the client's name, and you're going to hit new immunization. And again, I have that step-by-step sheet available, so no need to try to memorize all of this right now. But I'll just show you the type of information that's required. So once this immunization widget opens up, you'll see the ordered by section here at the top. That's always going to be Dr. Meyerson. If it doesn't auto-populate with his name, you could just click in here, start typing Josh, and it'll go to his name on that drop-down menu. And then the administered by over here is always going to be you. Date and time of administration does auto-populate, so you won't have to put that in manually. Our first section down here for vaccine information is how we pull up the actual vaccine. So we type in a number here. The drop-down list will show us everything that we have available in our inventory. So we're just going to type in the number. I have these numbers on the cheat sheet, but the Pfizer is 208 and Moderna is 207. So I'm just going to type in 208 here, and you'll see on the drop-down, it just brings us right to that vaccine. So we'll just click on it. And then the next thing we have to enter is the eligibility for insurance purposes. And that's always going to be public purchase. So either COVID-19 vaccine, Moderna or Pfizer, it's always going to be this one selection because, the vaccine was free to us, it's free to all. So we can bill for the administration, but for ease and getting people in and out of these clinics quickly, we're just entering this as a public purchase vaccine. We do always have to enter the dose number. It's either going to be dose 1 or dose 2 for the client. These initial mass clinics, I think they're all going to be first doses. So we'll just enter a 1 or a 2 there. And then based on this number that we put in here to pull up the actual vaccine, this drop down is going to populate. So this is only going to populate with what is in our clinic's inventory. So we're in the Charlevoix office here. That's my home office, so that's what automatically pulls up. If you're in a different county, you would pull up a different office here. If you're in Emmett, you'd pull up Emmett County. But this will only show you what's available in that inventory in that clinic. So this is the accurate lot number. So I will just select that. So it's not a process of, hand entering the lot number. You're selecting it from a drop down there. And then you'll have to enter the dosage amount. Again, Pfizer is 0.3, Moderna is 0.5. The administration route, that's going to auto-populate. They're only IM, so that'll always pop up there for you. And then you can enter the site. So 99% of the time, I'm sure it's going to be left or right deltoid. And then VIS presented as a box we always have to check before it lets us save. And generally, that's the vaccine information sheet that we're required to provide. But here with COVID-19, it's an EUA sheet. But we're treating that as the same thing. We're just acknowledging that that was presented to them. And just so you know, during the clinic, that EUA sheet is going to be given to them by our greeters in the beginning of the clinic. So they'll have that long before they get to you. You can just confirm when they're there with you that they were offered it or that they were given it. And then all you do at that point after this information is entered is hit save. And that is it. Once you hit save, this list right here, still under this immunization widget, the vaccine that you just entered will populate right here. So I'm not going to hit save because I don't want it to take that dose out of inventory. But once you hit save, you'll see that populated right here. If you don't see the information here, that means you either forgot to hit save or, forgot to enter a bit of information here that all those red asterisks have to be filled in or it won't let you save. So we just want to make sure that's saved because we've been running into some problems with people don't hit save or forget to enter the vaccine. And then at the end of the day, we have to enter that. So we got to try to track down a lot number and what arm it was given in and all of that. So it's important after you hit save to just make sure right here that that populates on that immunization list. If it does, you're good to go. And then you would just type in your next patient's name right here. So that is it for Patagonia. I know that's a lot of information if it's something you've never been exposed to before, but those cheat sheets that I have, we can get out to you and they're pretty easy to follow. And we can get you into some of our clinics for a day of shadowing orientation training so that you can get a little hands-on exposure to the charting process and the immunization process. So the next thing I'll cover is a few of the sheets, the paperwork that you'll see during the clinic. This first one is the flow sheet or consent form that we use at our clinics. So the client's name will be put up here by the tech when they first come in the door and get them signed in for their appointment. And then these yes or no questions the client will check off. So basically what you need to know is when they bring you this flow sheet, if you're the administrating nurse, they will hand you this flow sheet so that you can sign the bottom. We've been signing our first initial and last name and trying to do it as legibly as possible so that if we do have to go back and rechart it for some reason, we know who administered. But just take a look at these yes, no questions whenever the client comes to you. If they did mark yes on anything, then you'd need to assess that a little further to make sure they were still okay to get that vaccine. That second question there, has client received vaccines in the past 14 days? We do not want to give COVID-19 vaccine if they've had any other vaccine in the past 2 weeks. And then we also advise them that they shouldn't have another vaccine for the next 2 weeks. If they're getting their first dose, then I'll usually tell them you shouldn't get any other vaccine until 2 weeks after your second dose. And then the other questions there are pretty straightforward. These two sheets are also given to every client when they come in, and they'll be given by our greeter. Well, the first one, the V-Safe, will be given by our greeter. And that's the app that you can scan on your phone, and the CDC is using that as kind of a data collection tool, and they reach out to everyone. If you've all gotten a dose of your vaccine, you probably know this, but kind of a way to monitor side effects and collect that information. So we always provide them with that, and they can kind of look that over while they're waiting in line, even get it downloaded onto their phone while they're waiting. And then that sheet on the right there is kind of an aftercare sheet that the nurse will provide for them after they get their vaccine. You know, common side effects to expect, when to call the doctor, a reminder about that V-Safe. So those are two papers that we'll want to make sure they leave with, and then again, they'll always have that EUA fact sheet, which unfortunately is like a 5 to 7 page document, but that'll be passed to them in the beginning of the clinic by our greeter. One thing I thought was important to cover was an anaphylaxis review, especially with this being such a new vaccine and a new technology. Keeping an eye on people and making sure that they don't have these anaphylactic reactions, and if they do, how to deal with them. So at the Health Department of Northwest Michigan, we have an anaphylaxis protocol. There's a link to it here. Basically, it's a step-by-step form with what to do in that situation. We have anaphylaxis kits, small blue zipper pouches that we keep in every clinic. So at every clinic, there will be one of these anaphylaxis kits available. The paper protocol is folded up inside there as well. But if the occasion were to occur, we would get into that anaphylaxis kit, pull out the protocol, and then begin the process of treating them. Even with EMS on site, the nurse will begin that process, and then someone else will run to get EMS in there. If it were a clinic without EMS on site, the nurse would start the process of treating, and then someone else would call for the ambulance. So there's Benadryl and epinephrine in those kits, along with all the supplies for administering and instructions. So if you do want to pull up that sheet, you're certainly welcome to look that over a little bit for our policy. Anaphylaxis is rare, but it's life-threatening when it occurs, and it's important to be able to differentiate that from just syncope or anxiety, which are much more common. So I've listed some physical signs here of anaphylaxis that you can look over a little bit, and then some other symptoms that could occur during anaphylaxis. So lots that you're probably familiar with, but it's kind of a good idea to just brush up on that. Some other points that I wanted to cover quickly, and if you do take part in any of our just-in-time trainings going forward, these points would be covered in more detail, as well as, like I said, the clinic flow for each specific site, as far as where to park, where to show up, what to do when you get there. There's a pre-clinic huddle at all of our clinics as well. One of our supervisors will act as an incident commander for each clinic, whether it be a small or a mass clinic. There will be an incident commander on site who can help guide people and make sure everyone knows what their role is. So some requirements, surgical masks. If you don't have any surgical masks, you're welcome to wear a cloth mask to the clinic, but then we'll have surgical masks that you can change into when you get there. And so we do require that those are worn properly at all times. We will have our nitrile gloves. Those are required during drawing up or reconstitution of the vaccines. They're not required during administration, but they'll be available. And then during administration, whether you're wearing the gloves or not wearing the gloves, to change gloves in between and or sanitize hands between each client. And then we will also have face shields available for those administering. Right now, we're requiring that face shields are worn along with the surgical mask during administration. If you do have an appropriate pair of goggles, though, you can wear those along with the surgical mask instead of a face shield if you'd prefer. The standing order, I think Pat touched on that a little bit in the beginning of our training today, but there's a standing order specifically for COVID-19 immunization that Dr. Meyerson has drafted. So we'll have all of you guys sign that via an electronic signature link that we'll send to you via email. And we just want to make sure those get signed before any actual administration of vaccine. As far as CPR certification, we just require at the health department that 2 staff members at each clinic are CPR certified. So it's not required that you have that active in order to work a clinic, but it's always good to let maybe the incident commander know on site that day whether or not you are CPR certified, just so that they can kind of keep track of who's their CPR certified people in case they are needed. The anaphylaxis kits and protocol, again, there's another link right there to that so that you can read through it if you like. And then I think I touched on this a little, but that we'll have the option, and Pat will be doing the scheduling of people into our current immunization clinics in order to shadow, observe, train for administration, for drawing up, for charting. So good to see all that live before you get to it on your own. And then, like I said, more specific information will be provided during our just-in-time trainings. And we haven't recorded one of those yet. They've kind of been changing every week with new information. And the one we did this week just started including Moderna education. So they kind of, they evolve and change weekly depending on what new information we have. But like I said, we do go over clinic specifics, where the site is, where you'll need to park, where you'll need to go, what your duties will be. So those will all be available in just-in-time trainings. And that is all I have for this slideshow. So I think that concludes our overview of our COVID-19 immunization orientation for our volunteer nurses and physicians. So I am going to stop this recording and then we can open it up for some questions.